So this one we're doing skit number 5. I'm the nurse again, visiting 72-year-old black man, Mr. L, living in a ghetto with his wife, has hypertension, recently had a stroke, left his left arm weak. He has multiple prescription medication on the counter. I'm supposed to question him about that, and what else? Yeah, he appears to be drinking, so we'll see what's going on. All right.
Yep.
Hi, is Mr. L available?
Yeah, that's me.
Okay, hi Mr. L.
Hi.
Hi, my name is Kiki from Kaiser. I'm a nurse there, and I'm here to check up on you after your recent stroke.
Stroke? Oh, yeah. Stroke, yeah.
Okay, so how have you been feeling?
I'm alright. I'm cool.
You're cool? Okay.
Yeah.
Have you, obviously your left arm you're having some issues with after your stroke.
It's not as strong as it used to be, but, I feel like needles sometimes, it feels like my arm is heavy, you know what I mean? Like my arm is heavy. Mm-hmm. Like this, my right arm is cool, but my left arm is just, it's not working it's not the same on each side.
Okay. Yeah, I understand your concerns. Obviously after you have a stroke, it's going to be, difficult for you to move the side that's affected. Mm. So it takes some time to adjust. So, you just got to stick it through. But have you been taking any kind of medication for your hypertension?
Man, the doctor's got me on a bunch of medications.
Okay.
I just, my wife be taking, just giving me my medication. They put them in one of those little pill things, but it has days. Mm-hmm. She just puts them in there, and I just take them on those days. And yeah, that's about it. I'm not quite sure what they are, but I'm just following what they say on the bottles and stuff. So.
Okay. I wouldn't. If you have time, I could, and sit here and tell you more about your medication if you'd like to know. Right. I could, so you're aware of what you're taking, because, mm-hmm. You are taking it and it's going in your body, so it would be nice for you to know what they are. Yeah. That's if you like, I could do that. But I do want to know, are you consistent with your medication? Are you taking the dosage, the correct dosage daily? Are you skipping days or?
No, I take them all the time, but my wife, she puts them in there for me, and she's always, hollering at me about this, taking my medication and stuff. She's always worried about my blood and stuff like that. So I'm like, I'll just do it to keep it quiet, But.
Okay.
She be stressing me out sometimes,
Mr. L, I kind of smell alcohol. Are you taking any kind of alcoholic beverages?
Nah.
Okay, well, I just want to let you know if you are or not, it's up to you what you want to do, but the doctor does recommend you do not take any kind of alcoholic beverages while you're on your hypertension medication. Because it could.
I'm not gonna lie, but I had a couple drinks. I have a drink time too. Especially when my boys come over. I don't want to be the only one not drinking. So I throw beer back or two. But I'm not going crazy to the clubs or anything. So. I'll have a drink, time or two, since the stroke and everything, but okay. I feel fine. Okay. I feel good. I don't feel like, it's going to do nothing to me.
Okay. Well, considering your age and your situation, I really think that it would be ideal if you could cut down on your drinking. Yeah. And I know. I just think that would be best for you. But, like I said, if you decide to, you can do whatever you want, but the doctor highly recommend you don't drink and take the prescription medication at the same time. And I understand.
Have another stroke?
If you do, you can. If you don't want your diet, drinking alcoholic beverages is part of your diet. You are intaking that to your body, it could affect, chances of another stroke. And then, are you also eating any kind of? Are you eating a lot of red meats? Are you eating a lot of vegetables lately, or have you changed your diet in any kind of way? Because
not really. It's I'm kind of. I'm old, I kind of just like accepted the fact that I'm kind of like, deteriorating and stuff like that. So I kind of just eat whatever, fried chicken, whatever, potato chips. I mean, if it's cooked, man, I just eat it, So, I just eat whatever's there. I really don't pay no mind, so.
Okay, I understand, Mr. L. I do want you to. I know. I understand your your age and everything. So I do, but I do want to make you aware that the food choices you decide to ingest can, up your chances of getting another stroke. And that's not something. That's just not something that affects you. But it may affect, your family overall, because they care about you and they don't want you to be in pain of any kind.
Stressing.
So that's something for you to consider.
Yeah. I got you.
Okay. So do you have any other questions that you would like to tell me? Or?
I don't know, man. My ladies be talking about my blood, how do I get it off my back, She be telling me about my blood.
Well, if you take your medication on time, if you take the right dose on time daily, as recommended by the doctor, you should see improvement in your hypertension. It does take about, it's not going to be instant. It takes about a week or two before you see the results to, start occurring. So I recommend you just started on this medication, last week. So, and if she's taking your blood pressure for you daily, she should start seeing results very soon. If the medication is not working for you, you can always contact the doctor and he will prescribe you a different medication. So you would have to talk to your doctor about that. But so far at this visit, I will document it and I'll let the doctor know. And if you have any questions, just give your doctor a call. Okay? All right. Thank you, Mr. L. Okay. So we're doing the discussion for this skit.
All right, back again. How did you use the principles of effective communication in the interview?
Effective communication, I let the client, tell me about his situation. I wasn't quick to jump the gun. I just elaborate on, what his concerns were. He was he was able to, tell me how he felt about, his medication and everything like that. And he was very honest about his diet. So I kind of gave him pointers, let him know what would be suggested. But I didn't, make it a have-to kind of thing. So I think my communication with the client was decent. So.
Yeah, it was good. Definitely clear on the advice. I just felt that she hit all the notes again. I mean, maybe a little bit into more detail. Maybe it's just because so you need a lot of refreshing on some of the information. But just explain to the client how maybe hypertension works and that it's not related to blood. But I mean, blood is part of it, but you were more worried about taking care of the heart and the vessels. But I mean, I don't know, it's taking care of a person of that age. They're kind of set in their ways and stuff like that, and they're kind of hard to convince. So I think she did a really good job of trying to, better the situation without overstepping any boundaries of the elderly, because they get kind of they're kind of adamant on doing things their own way and stuff like that. So that was really good. What constituted the major stalls or blocks in your interview?
So the major stalls or blocks I really considered for this interview in particular is probably when Mr. L was got his mindset on drinking. he's just, and he wasn't really trying to alter his diet. So I kind of felt like a little helpless at that point for me. Like, I'm trying to help him out, and he wasn't trying to change his mind. So even though he felt that way, I still went ahead and elaborated on what what he should be eating or what he shouldn't be eating, and the whole drinking thing, why it wouldn't be good for his condition. So
Do you think that being a black man in a ghetto and stuff like that, and having that kind of like slang accent and urban slang and verbiage, do you think it hindered you from getting your message across, or kind of like relating to him?
No, because we were taught in Marcia's class for cultural competency, so you're supposed to be able to. No, I'm just saying. So you should be able to, as a nurse, a psych tech, a doctor, or whatever. You should be able to, deal with clients and from different cultures and that has different traditions or things like that. Deal with them accordingly. I mean, just because he didn't speak the way I did or dress the way I do, that doesn't mean I have to treat him disrespectfully or in a different way. So
she maintained her professionalism during the. What feedback can I offer you in approaching an interview like this? I don't know. You like the first one. You definitely came in very professional and very caring. Diving in. I don't know if I'm a really good actor, but I was trying to do the gestures and the feedback, and I don't know if you picked up on those or whatnot. But yeah, definitely taking into account using all your senses to assess the patient. Like you did, you noticed the smell. So I mean, just using all your senses to assess the scene, the environment, as well as the patient. And to provide the best care is probably the best thing. I mean, you use it in every situation, but I mean, in this case, making sure that you're safe. I mean, you're going into a ghetto to check on a patient and stuff like that. Definitely, you want to be mindful of your safety. So, I mean, that's the only suggestion I can think of.
Okay. Yeah.